All right. Well, first of all, thank you to Jetro for organizing this event. We're very happy to be here with you guys today. My name is Beth Ann Lopez, and I'm the co-founder and CEO of Docosan. And Docosan is a health tech platform that is based here in Ho Chi Minh City, Vietnam. You might be wondering about the name Docosan. It almost sounds Japanese, but it's actually a mixture of English and Vietnamese languages. It's doc as in doctor, and then Go-san is in available in Vietnamese language. So that's where the name Docosan comes from. And a little bit about myself. So prior to founding Docosan, I worked in community healthcare in Southeast Asia for almost 10 years at this point. And it included roles from a volunteer with a Peace Corps to consulting with USAID to doing the market launch of an app for pharmacists. And that's what originally brought me to Vietnam. So very happy to be here today and to introduce you guys to what we are building at Docosan. So the problem that we're addressing is that it can be very difficult and dangerous to find a good healthcare provider in Vietnam. So the first major issue is that there are huge variations in quality and price between providers. You can go to 5 different dermatologists and they will have 5 different prices. They will have 5 different workflows, 5 different quality levels, and there's no way to have information about them, about what you're going to pay and what to expect ahead of time. People are still using word of mouth to choose their healthcare providers, which really limits how they can find them. It's only limited to their own personal networks. And patients often experience long wait times. This photo here was taken just prior to the COVID lockdowns by my marketing manager. And he was going and talking to the people who were waiting in these lines, and they had waited for 4 hours to see a doctor. When they saw the doctor, they only saw him for a couple of minutes. And so, of course, for both sides, it's a difficult situation. The staff are overwhelmed and stressed, and then for the patients, it's not a good experience. Additionally, there is no coordination of healthcare. So patients often have paper records that they take with them, and doctors may or may not check those paper records about family health history and previous visits to other doctors. And of course, without checking the full health profile of patients, we can only get a limited view of their total health, and that affects health outcomes negatively. And so what ends up happening is it's a lot easier to treat yourself. You can just go to a pharmacy and buy some medicine over the counter here, or you just wait until the problem is big enough that you have no other option than to go to a hospital. And by that time, the problem is bigger, and so it's more of a health problem for you. So this is a difficult situation. And it's also a huge market opportunity for a health tech platform. So there are rising incomes in populations throughout Southeast Asia. And with those rising incomes, people have higher expectations for the quality of healthcare. They don't want to wait in these 4-hour lines and see the doctor for just a few minutes. They expect a more holistic approach. Additionally, outpatient care is mostly in the private sector. It's growing very fast. There's increasing out-of-pocket health costs, and so patients are more conscious of how they're spending their money, what it's going to, wanting to use that for quality healthcare services. Additionally, there's a new market for digital healthcare services, and that is in certain areas that are particularly stigmatized. So, for example, when people are looking for sexual health resources, so for example, getting birth control or other types of family planning, they might be embarrassed to talk to friends and family. And so the word of mouth network that currently dictates where people go fails. However, they're willing to look online. And so they can find many platforms and find solutions to get treatment for sexual health online. And that is another growing driver of this opportunity. Something that surprised me so much, especially when I was starting Docosan, is that there is no pan-Southeast Asian healthcare booking platform yet. even the booking platforms are quite fragmented, even though in many other countries and geographies, there are dominant healthcare booking platforms. So if we look at Europe, there's Doctolib. It is a French healthcare booking platform. It's valued over $1 billion. In China, they have WeDoctor. It's a $7 billion company. The Middle East and North Africa has one called Visita. And so if we look at Middle East and North Africa, they have lower levels of cell phone penetration. They're maybe not as connected as they are in Southeast Asia. And so there's just this huge gap. And why do you have this tech-savvy population, but no major booking solution to help them navigate the healthcare system yet? The regional booking platforms tend to be focused on 1 or 2 markets only. So there's some big ones in Indonesia, but they haven't gone to other countries yet. And so this is where Docosan comes in. We are a transparent digital marketplace that makes it effortless to find a good doctor. So we have over 800 verified healthcare providers. And when I say verified, that means that we have actually met these doctors in person. We have a signed contract with them. We have checked their medical license and practice certificate, because in Vietnam, it's not always a given that the clinic around the street is fully licensed. And this is a worry for patients that they might be going to a clinic that is not fully licensed. And so we only allow verified providers onto our network. These providers offer over 30,000 priced medical services that you can book for online through our platform. Patients can read through real reviews, order home test kits, and then benefit from promotions and discounts that they get when booking in advance. So it can actually be cheaper to book online than it is to just go in person. Additionally, we have portable health profiles. And so doctors can easily send clinical information and records directly to the patient. They'll receive them on their cell phone, and no matter how many different doctors they go to, they'll have the information there at their fingertips. They can easily share it with the doctors. There's no worry about losing paper records. For the providers, they're interested in joining us because it's a way for them to digitize their presence and to really expand their client bases from word of mouth all the way up to millions of people across Vietnam now. We have a clinic management system with cloud-based scheduling, SMS, email, and other CRM tools, and we also offer telemedicine through the platform. And so this is another overview of what the patients get access to. I think I kind of went through most of these. And then another exciting feature that we have recently launched is home test kits, starting with COVID-19. We follow international care standards and treatment guidelines, and we just digitize that process. So we can sell COVID rapid tests, we can sell other rapid tests direct to consumer, and we couple that with a telemedicine visit with a local registered doctor, so the patient can get the advice and treatment that they need without having to go to a clinic at all. So this is the product on the doctor side. It's a comprehensive calendar and patient management system. So they get digital profiles that they can publish online so that many patients can discover them. They can get the cloud-based bookings. They can set recurring reminders and updates for their patients. So if someone has a recurring appointment, you want to have the patient come back once per month, it will do that automatically. You don't have to have a secretary call the patient once a month. It will all be done through the tech. You can offer promotions and deals, as well as conduct those telemedicine visits. And so Docosan was launched in just April of 2020. And since then, we have grown and built a very powerful platform. So in addition to our large and growing doctor network, they cover over 35 different medical specialties. And this ranges from basic primary healthcare, pediatrics, all the way up to neurosurgery, cancer, anything complicated we have on the network as well. We have medical laboratories, home visits, and we have a presence in 8 different cities across Vietnam. Here you can see a little bit of our network. And so it ranges from small mom and pop type of clinics where it might be 1 or 2 doctors working directly with patients, all the way up to the largest private medical system in Vietnam, which is Van My Hospital System. We work with pediatric chains. We have chiropractors. We have, a lot of them are international, speak multiple languages. We have providers that speak Japanese, for example, English, Korean. And so what we have built is something that is quite different from the other platforms that are available on the market. So we offer comprehensive care. So you can go online and offline to go and get the treatment that you need. In addition to ordering these home test kits direct to your house, where you can actually get the treatment and testing without having to leave. And so this makes us quite different from the rest of the competitors in the landscape. And so you can see a bit about the background of our team here. So my own background was in public health. My co-founder, Natalia, is our chief product officer. She runs our tech team. She's another Harvard University graduate. She used to work at Google. And then we have experts in healthcare as well as business and startups from Vietnam. And so, for example, Mr. Hien had worked at one of the largest startups here. He had started his own agency before. And so everyone is very dedicated to bringing our mission forward of helping people effortlessly access healthcare. Our advisors include clinicians such as Professor Pham Le Anh. So Professor Anh is the father of family medicine in Vietnam. He lobbied very extensively in the 1990s to get family medicine recognized as its own profession. And we recently co-authored a paper in the British Medical Journal, which is very well known among the medical community, about launching our marketplace and how it improves healthcare access and transparency. One of our other advisors is Dr. Polak. So he is based in Hanoi. He works very closely in advising the Ministry of Health. And with him and his organization, Docosan helped to digitize the national HIV/AIDS treatment guidelines for doctors. And so doctors across the country are now using this app that we built together along with the Ministry of Health. And so now is the best time to get involved with a healthcare marketplace startup like us, because COVID has supercharged our growth. So some part of our offense is that we have zero marginal costs. It's a marketplace, it's software. The more users we get, the faster we grow, the more valuable the marketplace is. We have unlocked a new supply. So we're helping to eliminate the scarcity of healthcare knowledge. You no longer have to wait for hours and hours and hours to go and see a doctor only for a couple of minutes. Instead, you just hop on a quick video call with them. You can order tests directly to your house. You can get medicine sent directly to you. And so this is making it much easier to access healthcare without burdening the healthcare human resources in the country. And so we've also turned a 100% offline behavior in which people would just go to the clinics and wait in line into a digitally enabled and vastly more convenient and safe experience. So no more need to wait in those crowds, no more need to worry about contacting COVID now in this kind of environment. So it would be impossible to go back to wanting to wait in those lines as it was before. And so for our colleagues over at Jetro, we envision several different types of collaboration opportunities. And I'm very keen to talk to you guys after this and connect with you after. But for any healthcare providers that are active in Vietnam, we're keen to have you guys join our network. It's a great way to open up your practice to many more patients. For the employees of Japanese companies, we can offer customized health checks. And so these can be at clinics that even have Japanese language, like translators, and that have very nice, high quality, efficient types. We also have so many different types of providers that we can provide mental health consultations and things that are not so typical for a normal health check package. Additionally, we have at-home testing and telemedicine services that can be useful for the employees of Japanese companies. And if there are any pharmaceutical companies in the audience, we are able to facilitate patient assistance and education platforms through our platform as well. So thank you very much to the organizers again and to the participants. And I would be very happy to take your questions. Thanks.